Hello, in this video I'm going to go over the basics of breathing, also known as pulmonary ventilation. You probably know there's two major parts to breathing, inhalation and exhalation. We actually have fancier words than those. We call inhalation inspiration and exhalation is expiration. Don't overcomplicate the process of breathing. It's actually relatively simple. There's some really basic physics going on. And then we're going to use just a couple muscles in the body, the diaphragm and intercostals. The basic physics involved here is the fact that gases move away from areas of high pressure towards areas of low pressure. And you probably already know this. If you've ever let the air out of a balloon, you've seen this happen, right? As the air leaves the balloon, what's happening is it's leaving that area of high pressure inside the balloon and moving to the area of low pressure, the atmosphere outside of the balloon. This same concept applies to breathing. When the space inside of the lungs gets bigger, the pressure drops inside of the lungs. That will cause air to move into the lungs. But when the space inside of the lungs gets smaller, the pressure increases inside of the lungs, and that causes air to leave the lungs. During the process of inspiration, what's happening is the diaphragm is contracting and moving downward. So as the diaphragm contracts, it moves downward. The diaphragm is a horizontal muscle in your body, and it lies just under your lungs and heart. So when it contracts, it moves down like we see in the image here. The intercostal muscles are also involved with inspiration. These are the muscles between your ribs. When these muscles contract, it expands the rib cage outward. Basically what's happening here is by moving down and out, we're increasing the space inside of the lungs, which means the pressure inside of the lungs will drop. And now the pressure inside of the lungs is lower than the atmospheric pressure. Gases move from the area of high pressure, the atmosphere, to the area of low pressure, inside of the lungs. It's that easy. And the funny thing is expiration is even easier because expiration is actually driven by a passive process where muscles just relax. So those same muscles are involved, the diaphragm and intercostals, but they're going to relax now. When the diaphragm relaxes, it moves upward, right? Pushing up on the lungs, making the space inside of the lungs smaller. When the intercostals relax, the rib cage presses back, again, making the space inside of the lungs smaller. When the space inside of the lungs decreases, the pressure inside of the lungs increases above atmosphere, which causes the gas to move from the area of high pressure inside of the lungs to the area of low pressure in the atmosphere. We have something called the respiratory cycle. The respiratory cycle is just referring to one complete cycle of inhalation and exhalation. It takes about 2 seconds for a normal inhalation and about 3 seconds for a normal exhalation. How many respiratory cycles occur in 1 minute, assuming a 5-second respiratory cycle? If you said 12, you're correct. How would that translate to how many breaths you take per minute on average? If you said 12 again, you're correct. I want to talk about some terms that apply to pulmonary ventilation. Eupnea is normal breathing. That PNEA suffix refers to breathing, and EU means true. So this is our true, normal, everyday breathing, where we use the diaphragm and intercostals for inspiration, and then those relax for expiration. But there is something called forced breathing, which is known as hyperpnea. This occurs when we exercise, but it can also occur intentionally. If you take deep breath during meditation, something like that, that will be an example of hyperpnea. What happens during hyperpnea is we're actually involving additional muscles beyond the diaphragm and intercostals. So when you take that deep breath, you get taller, right? You got erector spinae muscles involved, abdominal muscles being involved, shoulder muscles, neck muscles. There's a lot of muscles that can be involved with the process of hyperpnea. Something else that's kind of related to hyperpnea is the Valsalva maneuver. And this occurs when you take a deep breath and hold it. As you take that deep breath, your diaphragm moves down, pushing on the abdominal contents. And we can use this high pressure in the abdomen to do things like expel contents during urination, defecation, vomiting, and even during childbirth. In biology, when you put that letter A in front of something, it means not. So apnea is referring to not breathing or stopping breathing. You might have heard of sleep apnea, and this occurs when the tissues in someone's airways collapse at night while they're trying to breathe, and that collapsing of the airway prevents them from breathing, hence apnea. This is usually easily treated with something called a CPAP machine. CPAP stands for continuous positive air pressure. And basically what's going on here is they're synthetically increasing the air pressure outside of the person's body so that there's a higher pressure outside than in, so you're constantly helping to force that air in and keep those airways open. It does make exhalation a little bit more difficult, but it does prevent the apnea from occurring. Dyspnea is shortness of breath or labor breathing. You've probably heard this term a lot recently with coronavirus and COVID-19. So one of the symptoms of COVID-19 is dyspnea. This can also occur during an asthma attack and other situations. Tachypnea is an increased respiratory rate. We're talking about over 20 to 25 breaths per minute. And of course, this is something we would expect to happen during exercise. Don't confuse this with hyperventilation. Hyperventilation is overbreathing, but not for a physiological purpose. With tachypnea, there's a physiological purpose behind it, such as trying to get oxygen to the active tissues of the body, right, when you're exercising. Hyperventilation doesn't have a purpose. It usually is something that occurs during panic, for example. With hyperventilation, what's happening is the person is overbreathing and they're exhaling way too much carbon dioxide. And as the carbon dioxide levels in their body drop, it causes the pH to increase and become more alkaline in the blood. This alkaline pH in the blood causes blood vessels in the brain to constrict, shutting off blood flow to the brain, which is what makes people feel dizzy when they're hyperventilating. Sometimes they'll say to breathe into a paper bag when someone's hyperventilating because you're going to inhale a little bit extra CO2, and sometimes this does work. Bradypnea is the opposite of tachypnea. With bradypnea, we have a decreased respiratory rate. So this is less than 12 breaths per minute. Remember, 12 breaths per minute is the average respiratory rate. So for under that, that's referred to as bradypnea. There are some gas movements that occur through the respiratory tract that are not actually important for the process of obtaining gases and expelling gases. So these are air movements in addition to normal breathing. One example is coughing. Coughing is something that occurs to expel some sort of debris from the lower respiratory tract. Sneezing is the same thing, but we're trying to expel something from the upper respiratory tract. Laughing and crying, hiccuping, and yawning are also non-respiratory gas movements. Actually, what's kind of interesting is the anatomy and physiology that's happening with laughing and crying is almost identical. And if you think about it, that makes sense because you've probably been crying before and started laughing, and they kind of probably felt the same, right? So, I mean, obviously in our mind, our emotions aren't the same, but the processes are very similar. Hiccuping has no known physiological function. We do know that it occurs due to irritation of the phrenic nerve, which is the nerve that feeds information to the diaphragm. A lot of people used to think that yawning was a way to get extra oxygen into the body. So you're getting ready to sleep. Let's get a little extra oxygen into the body by yawning. But research now shows that we actually don't increase our oxygen levels when we yawn. So this might be more of a social purpose. Yawning indicates to people around us that we're tired or maybe bored.